Hi everyone, this is Kate Warnock coming to you from the GuideWell UST Global Innovation Center here in Lake Nona. I'm delighted to bring another guest with us here today. This is Dr. Eric Gratias. Eric, welcome to the interview.
Thanks, Kate. Thanks for having me.
Eric, your title is you're the Chief of Medical Oncology Services at eviCore. So let's start with a little bit of a description about eviCore and why you're here as a participant at our Greater Than Cancer Immersion event.
Well, eviCore is a large specialty benefits management company. We cover nearly 100 million lives across the country, more than 100 payer clients and roughly 30 provider clients. And so we're very interested in ensuring that American citizens get the best health possible and the best care supported by the best evidence. And we were graciously invited by Florida Blue to participate in this wonderful event that you've got going here today.
Excellent. Well, Eric, I got to watch you in action, so to say, so to speak. We had this interesting part of the conference where we called it the flipped panel, and we had experts up on stage, but instead of us hearing them talk, they sat on stage and asked the audience questions. And you had quite a bit to say. Can you recap what you found the most compelling about those conversations?
I think it was a great opportunity. What we were talking about today in there that was so compelling for me is how do we arm patients with better information? I mean, really, healthcare is all about the patient. And we're supposed to be helping them get better and giving them the information that they need to make the best decisions possible. And so much of the information is locked up in electronic health records or insurance claim files, and it's all there. But they're just, we're smart enough and we have all this mobile technology and this integration, and surely we can come up with a way to extract that information and put it in front of the patient at that critical time when they're trying to make these really difficult decisions about what's the right thing for me to do, what's the right thing for my family. And just, we have such a good energy in the room, and there were so many people that can touch on a lot of those areas. It was just a great opportunity to have some of those conversations.
Well, I think you prompted a lot of that conversation with the remarks that you made. So it was great to see you and your thoughts being shared. So let's go back to that statistic that you named around eviCore. I think that roughly translates, is it 1 in 5 Americans is touched by eviCore?
1 in 3, 1 in 4.
1 in 3, wow. Okay, so 100 million Americans in some way. So no doubt you have an extraordinary amount of data that you're able to look at. From a macro level, what are the trends that you're seeing?
Oh, there's so many. We have a lot of new information, and we have a group of really excellent physicians in this country that are trying to do the best they can for patients. The information is expanding so quickly that it gets past any one person's ability to keep up with it. And so we have physicians trying to stay abreast of the information and ordering tests and ordering therapies that they think are going to be the best for the patient. And in the overwhelming majority of the cases, they're exactly right. We do a lot of work in reviewing the evidence behind treatments and making sure that the patient's getting the right thing, and in the overwhelming majority, exactly what the doctor asked for is right, and we're able to help that move through very quickly. For the others, we're in a position to be able to help support those physicians and say, did you know, I know you asked for this, but did you know that there's this evidence over here that suggests that based on what you're sharing with us for this patient, this might be a different way to go. And it gives us the opportunity to have that collegial interaction.
Right.
Which sometimes results in them saying, yeah, but you didn't understand this. And I go, oh, well, that makes good sense. Gosh, you're right on, you really should do that. And sometimes them going, gosh, I didn't really know about that. That actually really is a good plan, let's do that instead. It's about that dialogue.
The dialogue and the fact that you both have the best interest of that your member, their patient at heart.
Exactly, and it's not about the money, because the nice thing and the bad thing about American healthcare is there's so much waste. If you just focus on doing the right thing for the patient the first time, the savings takes care of itself.
Right.
You don't have to worry about how much it costs.
Pretty simple solution, I guess, if you have the right conversations.
If you have the right conversations, that's where it starts.
All right, well, terrific. Well, Dr. Gratias, thank you so much for spending your time with us here at the end of day 1. I can't wait to see what kind of conversations you're going to prompt in day 2.
Thank you very much.
All right, my name is Kate Warnock. Thank you so much for watching.